Hi, I'm Dr. Liz, nurse practitioner, one of the providers here at Xpress Urgent Care in Orange County, and I'm here to discuss what monoclonal antibodies are and their effect in COVID-19 treatment. So what are monoclonal antibodies? One of the monoclonal antibodies is Regeneron, also known as Regen-CoV, which has recently been approved by the FDA as an emergency use authorization. Now, what are the benefits of Regeneron? Regeneron has proven to decrease morbidity and mortality as well as hospitalization rates with COVID-19. Our goal with Regeneron is to decrease those risks to our patients that we are seeing who are infected with COVID-19. Question number 2, what are the benefits of Regeneron? So some of the benefits of Regeneron is that, as mentioned, we want to decrease the secondary effects that come with COVID-19. So really what we're trying to achieve with this treatment is to decrease hospitalization rates as well as to improve and increase rehabilitation with COVID-19. So essentially we want to get you better faster. We also don't want you to suffer from any complications that come with COVID-19. So who can benefit from Regeneron? Regeneron has been approved for those who are positive for COVID-19 as well as those who have had post-exposure. So that means if you've been exposed to COVID-19 and you have a confirmed contact, then you may also qualify for Regeneron. But now let's jump into it. Who can qualify for this? Some of the qualifying factors are if you are over the age of 65, if you're pregnant, chronic kidney disease, immunosuppressive, lung disease, cardiac disease, and those are just some to name a few. So really these are for our high-risk patients. But recently we have also found that they've authorized for anyone over the BMI of 25 can also be approved for this treatment. So make sure to contact us. You can go to our website and we'll have an information packet on if you can qualify for this treatment. However, we also encourage that you contact your provider and also run it by them and see if you are a candidate for this treatment. How is Regeneron administered? So now you may be asking yourself, how is Regeneron going to be administered? Well, I've got that answer. Regeneron is infused via IV, and so you will essentially come into our office and the administration of this IV infusion is administered over 20 minutes. The total time in and time out can take about an hour or so, only because we do have to register you. We have to take a set of vital signs, we have to start the IV, and then we start the infusion as well as monitor you throughout the infusion and after the infusion is administered. Another way that we administer this medication is via subcutaneous injection, and the way that's administered is via 4 injections in the abdominal area. These are relatively I don't want to say pain-free, but they are not as painful as an intramuscular injection. Subcutaneous injections are administered into the subcutaneous fatty tissue, and so they tend to be a little bit more tolerable. So what do you do after the treatment? This is a question that we get asked a lot. Really, you just go home, you rest, and you allow the medication to do its job. Most patients feel the effect of the medication within the next couple of hours to days after the transfusion, or infusion, I should say. After that, if you're still having questions, you can follow up with your primary care provider, or you can also do a telehealth visit with us as well. As a reminder, this is for educational purposes only, so if you have any questions, please contact your medical provider. Again, we do administer this medication at all 4 our locations, so if you want to book with us, make sure to click the link below. We are open from 8 to 8, 7 days a week, sick today, seen today. Make sure to like, follow, comment, and share with the world. And my name again is Liz from Xpress Urgent Care. Can't wait to see you next time.